has gotten a chance to. And is there a motion to approve them if people have reviewed them and are okay with them? Excuse me.
So moved.
Is there a second? All those in favor?
Aye.
Any opposed? Hearing none, we'll go on to public comment. Is there anybody in the room or online here for public comment? Seeing none, we will continue moving on to the strategic planning session. Jeff.
Jeff is online.
Hi, everyone. I'm going to share my present. Oh, someone needs to provide sharing for me. Send the request.
Click allow.
Can we turn this TV on?
I know.
Oh, yeah, Andrew.
What should be on?
Sorry.
Turn that.
Yes. Yeah, thank you. I'll spin the entire time.
Yeah.
Stop sharing your screen.
All right, I have sharing.
There we go.
Awesome. Hold on, let me just go to my slideshow. I have to go to slideshow first, bear with me.
A little music today.
Awesome. Can everybody see that?
We can, thank you.
Great. I know, first of all, just thank you for having me and allowing me to participate remotely. I had the opportunity to be up there last week, which was beautiful. I hit the transition and the leaves were perfect. And we had a great all staff meeting with Pitkin County staff, but I appreciate the ability to present here remotely. So I know that Jordana is going to kick this off for us with an introduction, and then I will jump in and work us through the slides.
Great. So we are here today to give you an update on our strategic planning process. Helping us with our process here. So we're really looking to share with you today some of the key components of our next 3-year strategic plan, what we're thinking of including, and we really want to be able to get the feedback from the board today to be able to have this plan finalized by December. So Jeff is going to walk you through a high-level overview of the major components of the plan, and we'll focus on the 3 things that we're really hoping to hear feedback from the board on. So one is going to be around these pillars of success and the structure of the plan. EDI is the foundation underneath those pillars that are critical for the success. How our work plans and other external plans are going to fit into the structure, and then how we plan to monitor and report on this 3-year strategic plan moving forward. At the end of the presentation, we'll share what you can expect as next steps and answer any questions, and also that will be the time where we're really looking for feedback. So if you've got thoughts throughout, please jot them down, and know that there'll be plenty of time at the end of the presentation for all of that feedback.
Jordan, is EDI, DEI just reordered?
Exactly.
Okay.
So equity, diversity,
Okay.
inclusion, we can say them in lots of different areas or call them by a different word or name, but yes, it's the same concepts.
Okay, thank you.
Jeff.
Awesome. I couldn't hear the very first part, so I'm not sure if you introduced me, but my background, I've been in public health for 34 plus years. My last 12 years until April 2021, when I retired and then started doing some consulting, was as executive director of Boulder County Public Health. So again, I'm happy to be here. I'm going to work us through, and we're going to really going to focus in on that fourth bullet of strategic plan pillars and success today, and the equity, diversity, and inclusion. And that's where we're going to focus our feedback as well. But I did want to just give you a quick overview of the structure of the plan. This, as you can tell, we're really looking for a plan that is pretty focused, pretty tight, not long, that sits on a shelf, but really gets used day to day. And it's going to include a message from the director. It's about a half a page, vision, mission, and values. And staff just went through at the October 2nd meeting, and we identified a new set of values. So you'll see those show up in the plan. And then finally, we're going to end that portion of the plan with monitoring and reporting. So besides the strategic plan pillars for success, the other area we're going to want feedback from you on is on that monitoring and reporting aspect. So I wanted to start here because if you're not familiar with structures of plans that use pillars, and this is El Paso County's example, you can see an example here of what we mean by pillars. These are essentially, we're calling them in the Pitkin County plan, strategic plan pillars of success. And it's because it implies very specifically that if these are not in place, then we're not going to be successful at being able to complete the work that, as you'll see, Pitkin County is pretty well outlined already, already has a vision and a mission. And the work that's identified is going to, you'll see, is going to be in that top roof, is pretty well scripted at this point. But those pillars are what really need to be developed in order to be able to accomplish that work. So we're going to talk through those pillars specifically, and we're going to get into the details of what staff provided us in terms of input, in terms of what your pillars in Pitkin County Public Health need to specifically look like in order to be successful. And then in the plan itself, under these pillars, will come the objectives and the measurable strategies that will effectively be reported back out to you. And I'll show you some examples of that as we move through this plan a little bit more. The next thing I wanted to show you is this is the feedback that we received from staff on October 2nd. And the way that we got to this feedback is we asked the question, what are the internal capacities that we must develop to accomplish our existing work? And this is the information we received. There's a lot of info on this page, but we wanted to show you this information because it represents more completely the kinds of feedback we heard specifically. And then what we did was we took and we're starting, as you can tell, to start to categorize this feedback. And these are some of the pillars that we're thinking we may see. We're still refining this, but obviously today is a really important day because we want to get feedback from you as well. But you can see the types of feedback that we received. It was really actually pretty remarkable because most of this feedback was, we had two different groups. Most of this feedback came back pretty consistent and was actually fairly easy to categorize. But again, at the end of the meeting, what we're going to do is I'm going to pull this sheet back up. So you're going to see this slide again, and then we're going to ask you some more specific questions about feedback. But we wanted to at least show you the feedback that was there. And these are the three areas of pillars that have started to emerge at this point. And before I go to the next slide, I just want to see if Jordana has anything else you'd like to add to this.
I think you did a great job explaining it, Jeff, and we'll be excited. I'll be excited to hear feedback when we come back to this at the end of the presentation.
Awesome. So I want to take a minute to explain. So this is really with a focus on these two main components of the plan. And I want to take a second to explain what this graphic really means. The first thing that I want to talk about is the equity, diversity, and inclusion piece that you see on the bottom. We heard loud and clear from all staff that equity, diversity, inclusion really needed to be a very strong part of this plan moving forward. And that's what should really drive the focus of the plan and the work that's happening in the organization. We're going to talk in the next couple slides more specifically about equity, diversity, and inclusion, what that might look like, and how we might integrate that into the plan so that it becomes really the lens that staff all look through as they're thinking about doing work in the organization, as they're strategizing for how to develop these pillars, and for how they carry the equity, diversity, and inclusion work into the top of that roof, which is the existing work that already has been identified by Pitkin County Public Health. So again, equity, diversity, and inclusion, think about that as the foundation of the house. Without a good foundation, you're not going to have an effective house. Without strong pillars, you're not going to have a strong structure, and you're not going to be able to have a healthy and supportive roof. And those pillars are key because, again, if you don't have the things that you're seeing in those pillars, like a very strong workforce, like robust information technology, and like really effective community engagement and partnerships, because if you think about things like, as an example, your behavioral health strategic plan, that is part of the work that I'll use my little pointer here. So these are internal plans that are going to be supported by these things down here. This is your public health improvement plan. And these are your external plans, the Pitkin County strategic plan, the PAC plan, behavioral health strategic plan, which you're going to hear more about today as you go into your agenda, and the climate action plan. All these things are absolutely critical in order to be able to support and accomplish this work, to move you towards your vision and to accomplish your mission. Some of these things are going to make pretty obvious sense, and others may need more explanation. But that's essentially how this house is built. It's built on those pillars, and it's built on the foundation of equity, diversity, and inclusion. All right. So the next thing that I wanted to talk about, we're going to move now more into this equity, diversity, and inclusion, and what we did in order to come up with that foundation. So again, I mentioned this is the lens that you look through in order to decide what work is going to happen, how it's going to happen. It really brings in the principles of what's important to staff and what's important to do in order to accomplish equity, diversity, and inclusion in your community and internally within your organization. The examples that you see under these are just a few examples of what came up. Staff identified roughly 20 different principles related to equity, diversity, and inclusion in that October 2nd meeting. And you can see that these are some of those here. In the next slide, we're going to show you an example of what Pitkin County Human Services has done to really actionize these kinds of things. But these examples and the additional principles that we talked about, that we identified, we will work to integrate into the strategies and the objectives that you're going to see in this plan that would fall under those pillars. And then this work also gets carried into the work that was in the top of that roof. So really looking back at the work plans that exist internally and how to make sure that the strategies that are associated with completing those work plans and that work reflect these kinds of things, as well as the values that you'll see in the plan. Both these principles and the values will become reflections of what you see coming forward in those strategies and objectives. And then in the external work, which, as you know, much of that has been solidified. I think the behavioral health strategic plan is a perfect example of that. A lot of that work is established. You've got measures, you've got outcomes and strategies already built in. But staff taking these kinds of principles into that work is going to be really important for supporting the kinds of things in the community that are important. A good example of one of the things that we heard loud and clear from staff were focuses like, we need to make sure that we are engaging our community, especially our underrepresented community, and making sure that we are not developing things that we think works for them, but actually engaging them in the work of public health and getting feedback from them and trying to understand as best we can and create relationships with them so that we know as we move forward with strategies that we are doing it in a way that's going to benefit those underrepresented populations. Because again, and I think COVID was a perfect example of this. in COVID, we had a challenge with really reaching effectively underrepresented communities. And we ended up developing a lot of relationships with those communities that are going to benefit us into the future. And this is another example of how we carry that work forward here. Before I go to the example, either Larissa or Jordana, anything else you want to add to this?
That was great.
All right. And then at the end of the presentation, board members, you'll all have an opportunity to ask us any questions, talk about any concerns that you have before we get into the specific feedback session. So you'll definitely have opportunities for questions, and I can go back to any of the slides that I'm talking through now. All right, so I wanted to show you on the next slide the example. I really love this example from Human Services. So this is their equity and trauma responsive leadership lens. And I think this really helps put that concept of, if we're looking through a specific lens as we're developing our work and we're thinking about how we strengthen our internal organization, these kinds of questions help us frame that. So if you're thinking about work, I think a perfect example is this impact one on the left. So when decisions get made, asking these kinds of questions so that you're sure that you're really keeping the concept that you're saying is absolutely important in your organization, that equity, diversity, and inclusion concept, forefront in the decisions that you're making, again, the strategies that you're developing, and the way that you approach your community. It helps really draw that work directly into the work that you're doing in the organization. And I love that the focus has been so strong from Pitkin County to be able to focus and call this attention to this work. And before we go forward, when we had our October 2nd meeting, we did hear some questions from a few staff. They asked very pertinent questions around equity, diversity, and inclusion, and the use of those terms as it relates to some of the challenges that we're seeing in the current administration. So I want to boot this over to Jordana for a second to just talk a little bit more about, because we're going to ask you for some feedback at the end relative to this as well. And so you have the context of what we heard.
Thanks, Jeff. So the comments and questions from staff were really around the current federal landscape, and in some of the conversations we've had in this boardroom as well, of understanding that sometimes funding is being tied to making sure that folks are either using or not using these terms of equity, diversity, and inclusion. We know that some of the federal grant language right now is coming down and not allowing anything that is woke to be funded at the local level through federal grants. And so staff were just wanting to make sure that if we were using this language around equity, diversity, and inclusion in our strategic plan, which is an internal document, but everything is discoverable, that the board was behind the use of that work. In our,
What I think we should make clear, actually, before we probably proceed too much farther, is the board's role in this whole thing. So we are going to approve the strategic plan?
at this point, we're asking for feedback.
No, I know, but I want to know, like, big picture,
Big
what
picture.
role the board has over the strategic plan of the public health department.
Yep. So big picture, this will come back to the board for approval in
So
in
the board
January.
has final approval of what is in the strategic plan, just so we're all clear.
And so I think the question is, we know that we've got core public health services and responsibilities to be using ED an equity lens in the work that we do. We need to be competent in these skills. That is in Colorado state law. And we just staff wanted to make sure that the board was in support of EDI being this base level and called out in the plan, or if the board felt like we needed to
think about the language that we were using and potentially consider other kinds of language.
I have a question. I mean, how much,
Let's say questions at the end. I'm sorry, I interrupted with a question I shouldn't have. So we're gonna let them do their presentation and then
Oh,
at the
good.
end of
Okay.
this, there'll be time for questions. I apologize. That's on me. Bad leadership.
That's perfect. We want you all to be thinking about questions. We will come back to this for sure. All right, I'm going to keep us moving. We're going to have plenty of time for dialogue. So for the next slide here, and my slide for some reason is stuck. There we go. Hold on. Sorry about that. Let me go back. This is where we're moving now to monitoring and reporting. So the concept here is that, and I want to walk through this a little bit because there's multiple levels here. There's monitoring and reporting on this strategic plan that we're going to have here, that you're going to see that it's going to come to you in January for review and approval. There's monitoring and reporting on that. There's also monitoring and reporting on all of the work that you saw listed in the top of that roof. So individually, each of the programs will be monitoring their own work plans for accomplishments that relate to the strategic plan and that the strategic plan supports, as we talked about. So these pillars are going to need to be there in order to support that plan. That monitoring will happen. It'll happen on a quarterly basis with a leadership team, and they'll be tracking their own program outcomes relative to those things. The reporting that we're talking about here is coming back to you on an annual basis if you support this, and then reporting back on the objectives and strategies that would fall under each of these pillars. The reason that's important is it creates accountability for the staff, it creates accountability for the board, it creates accountability to the public, and creates trust because it focuses in on transparency of demonstrating the importance of this and then talking about how you've been able to accomplish different aspects of the plan. Even though it's an annual report, the board obviously and staff, if they saw that things were off track as they're doing their monitoring, they could always come to you before the annual report to say, here's something that we're either doing really well on right now, or here's something that we have more concerns on that we'd like to talk to you about before we get to the annual report. But the annual report is intended to really create the accountability and the movement forward. I don't know if I mentioned this specifically, although it was in the first slide. This is intended to be a 3-year strategic plan so that there would be objectives and strategies that are focused over a 3-year period. We're almost there. This is just an example of what reporting could look like. And one of the key components I wanted to just touch base on in this slide that I hope you see is that whatever goes into that strategic plan is intended to be measurable and time bound so that it's not difficult to come back and report the work that's being accomplished underneath each of those pillars and for the strategic plan. So we will be working on that. Those objectives and strategies will come after we get your feedback today on the pillars. That'll be the work of staff to move forward between now and the time that that plan comes back to you. But know that these will be SMART objectives. If people know that acronym, specific, measurable, achievable, realistic, and timely. So that it's easy for you to understand and it's easy for staff to be able to come back to you with. All right, I wanted to talk next steps, which I already covered a little bit of this just in what I just talked about, but in the October-November timeframe, we're going to be working, granted that we get feedback from you on what those final pillars will be today. But in the October-November timeframe, we're going to be working with staff to develop those objectives and strategies that would fall underneath this plan. I'll be working to put the information that we've collected up to this point, that includes the values, and includes the SWOT analysis, many of the things that have happened up to this point. I will start to integrate those things into the draft plan, and I'll be meeting regularly with Jordana and Larissa to bounce those things off of them before we get to the point where we've worked with staff to add the strategies and objectives in. We'll distribute the final plan or the final draft plan out to staff before it goes back to you as a Board of Health in January, so that we've built this platform of making sure we're sharing the information that we heard back from staff in the process, and we're developing the plan in collaboration together so that it comes to you as a final plan in January. All right, so the first thing I wanted to do, so there's two slides here. I'm just going to show you quickly, and I'm going to come back to this one. We're going to go back to this slide in a second. The first thing, though, that I wanted to do is just outside of pillar specific things and outside of the reporting, which I'll get to last, is do you have other questions or concerns that you want to talk through? So now would be a good time if you have questions around the equity, diversity, and inclusion things that we talked about, or any other concerns you have with what we just presented to you, or any other questions you have that you want us to dig deeper into. Now's the time to first answer those before we get into the pillar specific structure.
Susan, was that you that had a question? Or Barry?
Yes, I did. I just had a question. Regarding the EDI, just using that in the strategic plan as part of the titles or explanation. I just wonder how much could that affect, money we would get from federal sources? Does anyone have any idea?
Typically, for us to get federal funds, we are applying for specific projects or to be able to complete a specific task. And we have to apply for whatever the funds are specifically going to be used for. So we're usually just sharing, we're specifically applying. It's not usually connected back to our strategic plan or equity statements or things like that in any way. So I don't necessarily see it having a huge impact as to how federal funds have been distributed up to this date. But not to say that things couldn't change and that there couldn't be another provision put into federal funds.
How much federal funds do we get? Like, what percentage of our budget is grants?
Great question. It's oftentimes it's blended and braided into state funding that we get. So we've been learning a lot about it because sometimes the federal funding portion of our funds that come through the state has been delayed, and then we get the state portion, and then we're getting the federal funding a little bit later on. We do have one large grant through the DOJ that is all federal funding, but other
50%, 30%?
no
Yeah.
less.
10%.
Can I just make a quick comment? I just wanted to, my impression of all this is that it's a very gray zone. And we have no idea, and everything's interwoven and we don't know what's in the future. And the decision to either retain DEI, those words and those letters, or how many other public health nonprofits have done is just you reword it. You use the same exact meanings, but you use the words, I'm just looking up some words to rebrand, but you use the same exact meaning. So you're not changing your values or your goals or anything in any way. You're just simply using different words like opportunity, equity-driven leadership, access. There's so many other words that you can use. And so I guess the decision is going to be, do we want to say, hey, we're using these original letters and words.
Challenge.
We're not changing anything about what our goals are, but we're going to maybe be stubborn, maybe not, whatever you want to do and hold, stand up to what's happening politically. Or you just say, listen, who cares? We're going to do the same thing. Let's just use different language. So we put ourselves at zero or lessen the reduce it, lessen it in some attempt in this gray zone. That's my 2 cents.
I appreciate those comments. I have a comment more than a question because I work for the federal government right now. And I think that they look for ways to pick fights and possibly antagonize. And if we're Aspen, Colorado, this is a public meeting that we're talking about our strategic plan in. This may be enough, quite honestly, to put us on somebody's radar. And I think I'm along with Kim Liming. I'm just a person that would like to really make sure we have the right resources from our community that are not compromised. because I think our message is correct. I think what we do here and our work is correct. And I think that is the most important thing at the end of the day.
I agree.
I also agree.
I agree with you, Kim, that we need to sort of rebrand so that the DEI is sort of less on the surface. And because on the federal level, I can see what's happening at NIH, National Institutes of Health, CDC, and other places where that is not really on the billboard. And so it needs to be taken into account, but I think it needs to be sort of rebranded in those terms.
I mean, just words originally,
Yes.
everything's going to be the same. So just use different words.
Yeah.
And then we don't have to even worry about it. I don't know, that's my,
I agree. I think philosophically, you know, this is what we believe in, but trying to gauge the risk of using those words where it feels wrong to have to make this decision and to succumb to that pressure. But on the other hand, I think you do have to, as best you can, quantify the risk.
Yeah, I feel that it feels wrong, but it has to be right for the community, not just words.
yeah, just words. Whoever coined them originally did a great job, but we can do another great job.
Yeah.
Pretty cool.
And we actually had conversation like this at the October 2nd meeting with talking about exactly what you just went through. So I mean, Jordana, if she has other things to say, absolutely don't let me drive it one way. But we did have conversations like this. Many organizations have already rebranded without using these words and still are able to accomplish the values that are the strongest to them. And from my perspective, as the consultant to help guide this process, it's helpful for me to hear where you're all landing, because we can rebrand the process and still establish the values that are important.
Yeah, I think we've got some clear direction here. So I just want to thank the board for that. And you'll see that when it comes back in January. Thank you.
All right, how about other questions or concerns you may have relative to anything that I just covered?
Are you going to put up the pillars again?
Yeah, we're going to go to the pillars last. I just want to make sure if there's anything else that, and I can put the pillars up if there's questions in general on the pillars versus that specific language. Why don't I just go back? How about that?
I have another
Dr. Kurt, yeah.
part of the community health services that are provided through Pitkin County are on contracts through community health. And so is he aware of this sort of branch of our public health services, and is CHS survey part of that plan?
It sounded like the answer was yes.
So if you see in the other, Jeff, if you can pull up the other slide that has the details under workforce, and there you go. You can see some of the strength in the workforce capacity that the team was really interested in, was that clinical capacity, thinking through that and how CHS plays a role there, but also some other scenarios where we might need to strengthen the use of medical reserve corps, if we needed to stand up a bigger kind of event, knowing that even with CHS, that's only a couple public health nurses that are employed within that organization, and that if we did have to have a bigger response, we need to address that clinical capacity.
And just to point out, I'm on the board of Community Health Services. So it's a separate nonprofit, and although it does provide the clinical services for public health in the community and in the county. And I'm just looking at the values on the website. There's no DEI that's actually in here. It's equity, health, and accessibility. Those are the three values, but there's no, lettering of that. And I think it just has a quote, the mission quote, which no, actually,
It does.
it does. Yeah, it does.
Do
But
they
I don't know that that's something that we need to.
Do they apply for their own federal grants?
Yeah.
Separately
It's
from-
a separate nonprofit,
Mhm.
yes. So they have, yeah, so that might be a good conversation I bring back to them separately, but I don't think has to do with unless you do, yeah.
Any other questions on any of these slides before we get a little more into this?
Go ahead.
Jeff, I think we're ready to dive into
Okay.
additional pillars.
Awesome. So again, I just want to reiterate that you're seeing titles here: strengthen workforce, develop a robust information technology system, develop effective community engagement. And the reason that we wanted specific feedback here is because these things aren't final yet. But this is how things have, from our perspective, started to shape up in terms of what could be the final pillars. And we wanted you to see this language for two reasons. Number one, we wanted to make sure that we weren't missing anything specifically that you feel like is important as this process moves forward over the next 3 years. And then secondly, to make sure that if there's pieces in here that you feel like really need to be emphasized or need to be really strong pieces of this plan moving forward from your experiences, those are the two things we really want to be able to capture from you today. And Jordana, am I missing anything else there?
That's it. That's where we're at. We know they'll still, the titles or of the pillars may shift a little bit. But these are the main themes, from staff of what might be included within them. And really are curious from your perspective as the board and out there in the community, if there are other components of these pillars that we should be thinking about, considering, or making sure that we really focus in on.
I have a question on the building employee housing, and Sam may have a comment on this too, because of the other role, how I wear when we do this. Does the Board of Health really want to take on building employee housing?
That is a good point. So I think this includes all of the staff feedback and the comments. And I would say that is probably outside of our scope.
Liz?
Sorry, I can't remember, but are there any pillars that carry over from the last strategic plan?
So great question. So in our last strategic plan, we had 3 different priority areas. Hold those up for you so I can see accurately.
Just wonder if there are some similarities. Focused on vision.
That was, we had called it actively sustain and retain the right size public health team by promoting an inclusive, positive team culture throughout training, planning, communicating the value of public health. So that was definitely a workforce pillar. We had a communications pillar. So increased community engagement and awareness through communication of evidence-based public health information. Ensure we are known as a trusted source of information in the community. And the third goal was around institutionalized COVID learnings in order to be better prepared for the next public health emergency.
Any other comments or questions? Anything that's missing from any of your perspectives?
I think not. I think we think it looks good.
Awesome. Okay, so the last thing, Jordana, are we okay to move on then at this point?
One more question, Jeff.
So I
Okay.
don't know if this is the time to answer this, but how did IT, a robust technology? Is there needs or? How did that rise to?
I think that it was this concept of data. Right now, we're collecting a lot of data. And then I think we're a fairly new department, a few years in here.
So we have been collecting a lot of data, and I think the next step to really get us to the next level is understanding how are we using that data to continually improve, to understand what's happening in the community. Public health data tends to lag a lot from the time that you can get the data to the time when it's surveyed to then when it's actionable. So thinking about what are the measures that we can use that are a little bit closer to home, that we can get some more real-time feedback. We're doing this in our behavioral health strategic plan. We've got a plan for kind of a data dashboard. We've integrated this into thinking about our strategic plan and wanting to be more data focused. And so I think it's really this recognition that we've got a lot of data. We have a lot of data sources. Sometimes it's too much. So we need to really understand how to better focus in, how to make sure all staff understand those training opportunities. And additionally, a lot of pieces came up here about being able to talk about return on investment, the importance of public health, and how when we're investing upstream, that is so much more effective and better use of dollars than trying to impact outcomes downstream. And then also this concept of quality improvement and recognizing where we have opportunities to improve was also cached under this pillar. So we've kind of got to tease out of all of those different ways that we can use data. How do we become, what are the priorities that we want to work on? I'll say one more thing that we've been working on with a number of our contracts with community health services, contracts through the mental health, Vital Mental Health Fund. We've been asking for our folks that we've been contracting with to be providing us data. And I think then we can continue to improve how we use that data, how we share that data, and how we continue to iterate on those programs.
The other thing I'll add to that, because I have a consulting contract for CALFA, which is the organization of all local public health agencies across the state. For the next 2 years, following this year, there is a public health infrastructure grant that's in place with this very same alignment. So it is to help improve data infrastructure, access, the ability to use data effectively to make decisions. And there's some resources that come with that. So the alignment between this for the next 2 years and your plan for the next 3 years feels very timely to me. And there is going to be some ability to potentially make some headway here on this as well.
All right, thank you.
All right. Are we ready to move to the last question, which for me is, unless I'm missing one, is the reporting. Awesome. Okay, so let's just go back to here real quick. So again, the reporting that we're talking about will come back to the Board of Health on an annual basis, January timeframe, and it would include specific measurable activities that come back to you and objectives relative to what's going to end up in this final plan, with the acknowledgement that if staff saw something throughout the year that felt like it was a major threat or challenge, our SWOT analysis is going to get filtered into this as well. So there'll be strategies or thoughts about how to make sure that we're watching for those things. But if something comes up through the year, doesn't preclude staff from coming to you to give you a heads up on this. But this is the kind of reporting that we would be looking at, is again annually, and it would be specific to measurable activities, measurable objectives and strategies. Does that work for the board?
The monitoring you're asking about, not the objectives themselves.
It's the monitoring and reporting. So from a monitoring standpoint, staff would come to you if they see something that's off track majorly or that they would want you to hear about before it gets to the annual report. The actual report for the strategic plan would come in January as an annual report.
It looks like everybody thinks that sounds good, Jeff. Thank you.
Awesome. I don't have anything else, Jordana, unless you do. I'm going to go back to the last thing here, but I don't have anything else unless you do.
that's it. I think we've got feedback to be able to incorporate into the final stages of developing this plan. Thank you Jeff for your presentation, and board will bring you back in January.
Great work. Thank you very much. It's very well done.
Awesome. It was great to meet all of you. Have a good rest of your meeting.
Thank you. As Greg would say at this point, running ahead of schedule. 1:48. The next is budget recommendation for the OCC.
Great. So while Nancy gets this pulled up here, we'll be giving you all the budget presentation for for 2026 already. So we'll walk through a little bit of organizational structure, a little bit about what is currently going on in terms of the context that this budget has been developed. Then we'll have the deputy director and the two managers present their budgets. And then we'll be looking for a recommendation from the board if the board recommends this budget to the BOCC. If you remember, the BOCC is actually the one who makes the decision, the ultimate decision on approving our budget.
So would we vote today on if we recommend this? Thank you.
So we'll be looking,
I would just like to know our role and what's going on.
appreciate that. So we just start out with our current org chart here, and this was a picture that was just taken last Thursday up at Ashcroft when we were doing our strategic planning and retreat with Jeff. So we've got 13 full-time employees in the department currently. One term limited employee there in green, as well as one contract employee. And that is our department for the time being. The next slide, I just wanted to talk a little bit about the context in which this budget has been developed. So we recognize and acknowledge that there is volatility at the federal level, which has also affected the state level budget, which then impacts what happens at the local level. There's definitely a trickle down there. Additionally, at the local level, the county is predicting a 10% revenue decrease when the airport is closed, starting in 2027. So when we look at our 5-year projections, we know that the county is preparing and expecting that to happen. We know that there are impacts to social determinants of health, which impact folks in our community. Food security is being challenged by some of the federal program funding that is being cut. Medicare, Medicaid, nonprofit funding is being impacted. So while we're not seeing huge impacts right now to the public health funding from our traditional sources, we know that the folks that we serve in the community, the things that we look to address and prevent are going to be impacted. The commissioners also recognize this context, and they have decided to set aside a pool of funds to address those resulting needs that are affecting our partners or some of our internal needs due to those changing circumstances. At this point, they're discussing putting aside $1.5 million to be used over a 3-year period. So knowing the impacts at the local level are going to be way beyond that, that's not going to be able to fully fund all federal cuts that are coming down to the local level. But the commissioners are really trying to be able to have the goal of being able to look at this holistically, understand the impacts, and they'll have to make some priority decisions as to where they're willing to step in and address and offset some of those impacts. So that is the way that they will be addressing those issues. one other piece of the puzzle that we will be talking with the board about in upcoming meetings is that Healthy Community Fund, of which we'll see in our budget funds the public health department up to just below $1 million a year. Comes from the Healthy Community Fund. This is this expires in 2027. So we'll be going back in 2026, crafting of that ballot language and what services that the board shares and wants that to include will be process. The discussion will start taking place. So there might be a board of health advocacy work as we move forward, knowing that that's such an important funding mechanism. So public health receives 22% of the Healthy Community Fund currently.
Or the other way around. What percent of public health?
Like what percent of our budget?
Yeah, what percent of our budget does it?
Okay, great question. So
So we know like.
So the Healthy Community Fund, public health portion of that is about $900,000. Our total revenue, let's see. When we get to the budget slide, Kim, I might be able to
Okay.
walk everybody through that. And I can potentially do some math and come back to the
Okay.
board with the
Sure.
percentages and breakdowns. I hadn't had it broken down that way. But we not only receive Healthy Community Fund for supporting the public health department. The Healthy Community Fund also supports some of the critical health and human services in the community. So it helps to be.
Senior center. That's 70% of the budget.
Is it really?
Yeah, so it pays for the senior center and then some of the agreements that we have with Mountain Family Health Center. So there's a contract that the Healthy Community Fund helps pay for that integrated healthcare that's available in Basalt. It also helps to pay for withdrawal management. So that's the detox facility. Healthy Community Fund supports that. It also helps to support some of the vital mental health services that we pay for in partnership with some other municipalities in the school district and the hospital. And so the Healthy Community Fund is a major funder of not just the public health department, but the other supporting services in the community. Those are the big kinds of contracts that the Healthy Community Fund oversees, that pays for, that we oversee. It also supports a number of nonprofits in the community that help support health and human services. So that is the context. Any other questions there before we dive into the specific department? Great question. Thank you.
Okay, thank you. Next slide. So I'm going to review the admin budget, which myself and Jordana oversee. So just wanted to start with some of what the big priorities for the admin department, admin team next year. One, which you just saw, will be to implement and monitor our department strategic plan, which you now know will be brought back to you in January for approval. We also need to begin our data collection for our next community health assessment. So our community health assessment, we're required to do every 5 years, and we are coming up on that 5 years. So we'll be doing another assessment and collecting data to see what our community health priorities are. And then from that, developing what's called a public health improvement plan. And then lastly, related to kind of strengthening our workforce in that priority areas, continue our succession planning efforts to continue to preserve some institutional knowledge and continuity of operations in the event of public health emergencies. So those are kind of our big priority areas. Any questions there before I move on? Okay, next. And then for the admin budget, these are some proposed changes. Revenues, unfortunately, no increases. We are seeing a slight decrease of about 15,000 from our state local planning and support dollars, which basically just supports kind of core public health services. It currently goes to support one of our staff members that leads our community health assessment process. And then in our expenditures, we did budget for a slight increase in our payment to Eagle County Public Health because they provide WIC services to Pitkin County residents. We base that payment to them on actual costs, but we don't have the actual costs for this year just yet. So we went ahead and just assumed that there might be about a 5% increase in that payment. Fortunately, we also did decrease some expenditures for next year because we did do our strategic planning this year. We decreased our professional services budget by 19,000 since we won't be needing that service. And then also we kind of did an assessment of our education and training budget, which supports staff professional development. And decrease that slightly, about $2,600, just to better align with what we're actually spending and kind of allow for some greater flexibility in how those funds are used across the department. And that is it for the admin budget. Is there any questions? Yeah.
On the WIC payment to Eagle County,
Mhm.
is that payment based on the number of clients seen? So has there been an increase this year in the number of clients seen? Are you anticipating with that 5%?
So maybe both. Possibly anticipating more clients, but also anticipating that there might not, we might need to supplement
Yes.
a little bit more for them to serve those Pitkin County residents. So I think it could be either or. Like I said, we're still waiting to get some actual data from them from this year to kind of have a better understanding of what the needs are. And then once we have that, we can share that with the board too of what those actual residents served are.
And this has been a new addition to our budget in 2025. Eagle had been just taking our state allocation for WIC and serving all clients from Pitkin County. They were looking at their budget and realizing that they're heavily subsidizing the WIC program. And so came to us to ask us to pay for our fair share of Pitkin County residents who are using those services. So we're still fine tuning how we're paying for that additional subsidy that is not covered by what we get from the state to cover WIC programming.
And you're right, there is the current threat to those services internally.
Yeah. Okay, I will hand it over, I think, Jenny next.
This is a low chat. Good afternoon. I'm Jenny Constable, manager of the Planning, Education, and Partnerships team of Public Health. We work a lot in prevention and mental health. So this will be the changes to our budget, but first our priorities for the year. So the first part, which you'll get a lot more detail about in a few minutes, is to begin implementing the behavioral health strategic plan that was just completed and hire a behavioral health facilitator who would be the person largely responsible for implementing the plan. As well, we'll have some kind of a dashboard or report card for that behavioral health strategic plan and behavioral health indicators to show the community, the board, et cetera, where we are with implementation of the plan and hopefully tracking some indicators of how our community is doing on the behavioral health side. For the Pitkin area co-responder teams or PACT, their priorities are to recruit a second co-responder, which we've recently gotten more funding for, and then to continue their staff retention efforts. PACT also has its own strategic plan, so they'll be working on their strategic action priorities. And then our STEP partnership, which is the State Tobacco Education, why am I blanking? And prevention program, which we do for Garfield County contracts with us and gives us their allocation of the state funds, which makes it enough for us to have a full-time person that's working in both counties. So we'll continue tobacco policy efforts in Pitkin and Garfield counties, which includes things like getting local municipalities to pass tobacco retail licenses. Silt recently passed theirs. There's a few other communities, and possibly working on flavor bans in a couple of different areas. The town of Eagle actually just passed theirs. As well, we work a lot with schools and do partnerships around youth prevention, intervention, and cessation. Peter is talking a lot with the schools about what they do when a student is caught with tobacco, because we want to do our best to help those students and have the most evidence-based approach to that. And then for our kind of final mandate, we'll be working on refining and expanding our communications efforts, which we do at this time have a federal grant to help us do, and expanding and growing community partnerships, which is both a priority for public health generally and as part of those COVID learnings that we talked about in the previous strategic plan. We really want to bolster those community partnerships so that in the event of some other public health emergency, we have a lot of assistance in getting the word out and really working with the community proactively. Of course.
The tobacco policy efforts with Pitkin and Garfield,
Mhm.
when policy is passed, does it have to be passed by both? Is it a joint effort, or can we operate separately?
We can operate separately.
Okay, it's just
All the
for
municipalities
joint-
can.
It's-
So the joint part, yeah, it's basically Garfield. The state gives each county a certain amount of money, which actually increased recently. And so Garfield, instead of taking their money and having their own program, we combine it and have one person working in both counties. Because if we only had our funding, it wouldn't be enough for an FTE. So this way we have an
Gotcha, it's
FTE,
more an administrative issue, payment
Yes.
and admin. Thanks.
of course. So our proposed changes to the 2025 budget, we have several increases on the PACT side in particular. And the federal line, our DOJ grant has been in a planning phase. And so that funding increases as we move into the implementation phase. So it goes from about $100,000 a year to $200,000 a year. So that's that $100,000 increase. We recently got a state crisis grant to fund that second co-responder clinician. That's a really tight amount, but it will largely cover the salary, benefits, et cetera, for a clinician. And that is new, but it also largely replaces some other funding. That CDPHE, that STEP grant, that's our state tobacco grant, has increased by a total of $80,000 for Pitkin and Garfield counties. So we've been able for previously 80% of the position that's doing that work was funded by the grant. Now 90% is funded because the person does a few other things for public health in our core public health services, including the child fatality grant. And it'll also give some money for prevention work in schools. That's where we've been focusing that. We increased the budget by $6,500 for community outreach, which is also moved from the administrative budget to the PEP budget. So that's not a total change. The 6,500 is the total change. Just for better tracking and so forth, since PEP is the one most involved in our communications efforts. But we do see the need for growing that work in the future, making sure that we have money to be able to do that. And then our CDPHE child fatality grant has gone up by $300. But that is something that only happens if there is a child fatality in Pitkin County. Then we have a review of that to see if any prevention efforts could be added. Several decreases on the PAC side in particular. Our Behavioral Health Administration co-responder grant is decreasing by $86,000 for one position, but that's being offset by DOJ. So that had grown a couple of years ago to add a peer specialist, and now that's being covered by the DOJ grant, which is a 3-year grant. So we're in year 2 of 3 on that. And then our CDPHE harm reduction grant, which we had had since the middle of 2020, was not renewed. We did apply for that again, but it was a very competitive process and we did not receive it. But that will be partially offset by that state crisis grant of $112,000. I don't expect any expenditure increases. We'll see decreases in behavioral health contractor and other budget lines specific to PAC, training and supplies, et cetera, commensurate with those funding decreases. We had to make everything add up.
Well, the first slide, you did have another position for a behavioral health facilitator.
Correct.
Where's that?
So that, do you want to cover that in more detail or do we go ahead and answer?
I can share, that is coming from our joint behavioral health funders group. They have been up to this point funding a position right now that does behavioral health data analyst work. So we are essentially, because that is a term limited position, with this new strategic plan, which we'll get into more detail after we do the budget. The recommendation was to have a behavioral health facilitator as opposed to a data analyst. So we are sunsetting the data analyst, who's done fantastic work for us. But we are essentially then just going to be looking to hire a facilitator in the new year. So no net increase or decrease, but a change in the nature of that position and the work that we'll be doing.
Thank you. Any other questions? Thank you very much.
You're so welcome. Thank you.
We'll talk us through the environmental health budget.
This chair, this should be.
Didn't see the. All right, good afternoon, Kurt Dahl, Environmental Health Manager. Just a reminder, environmental health encompasses both, or 3 departments: environmental health, disease prevention and investigation, and then emergency preparedness, also known as public health emergency preparedness. So a lot of times you'll see the acronym FEP along with that, and that's really just talking about public health emergency preparedness piece. So next slide. So for our priorities in 2026, obviously we have several. Lincoln Creek Work Group, that is a continuation. That's a multi-year project. As a reminder, that is a work group that I'm co-leading with the Healthy Rivers Board, Lisa Tasker. And we are working with a number of different agencies, White River National Forest, Colorado Parks and Wildlife, the Roaring Fork Conservancy, private citizens, Independence Pass Foundation on looking at Lincoln Creek, which has what we've termed a naturalized or a natural source of contamination, copper, aluminum, and iron within the river that is then impacting that river. It has been considered impaired to aquatic life. There's a reservoir that is partially down that actually is a delivery for water to the Front Range that also has some impacts to it. Although again, being part of a larger system, the impacts are very minimal by the time it reaches the Front Range and their water systems. But then also looking at the Roaring Fork River and potential impacts with the Roaring Fork River that are coming from Lincoln Creek. So right now we're in the process of just assessing that watershed and putting a model together to look at the various sources of contamination, ultimately looking at, are there recommendations that the group can make around mitigation or potential for mitigation to address again any of the impacts that we possibly could alleviate, especially to the Roaring Fork River, excuse me. So in the expenditures piece, there's an increase for, again, an air quality specialist. This is a position we've been asking for a number of years, really based on the needs around local expertise with air quality. A couple examples of the work that they would do. We have the airport air study that is going on right now. Also encompasses some areas around the Aspen Airport Business Center in Burlingame. So really looking at the data that's getting collected with this, but then being able to interpret that data into understanding public health or potential public health impacts from pollution around those various sources. Airport, and I think it's important to also be talking about the Highway 82 traffic as well, because I think there are a multitude of sources here. So really looking at that data and then developing any concerns or around what public health might, especially the people that live in that area. And then again, developing any recommendations that might come out of that. Climate change is again a good piece that is a very important piece for the county. We need some various expertise that's beyond what Brian and I have, both in terms of policy, and the example I have up there is smoke forecasting. Right now, we're really in a very reactive mode that we depend on the state health department to help with forecasting that and then getting out communications. And really, we see a need for us to be more proactive with the community in terms of looking at the data and getting forecasts out in a more timely manner for the community so they can help with decisions and their activities outside. And then radon, we have an existing radon program, but there are opportunities to expand it. It really comes down to needing the staff time to do that and be, again, more proactive with not only we distribute kits, but then doing follow-up to make sure people are using kits. We have staff that are able to do that to an extent, but it would be to a greater extent following up and really trying to make sure people understand the importance of using that. We only have about 30% of the kits we give out that are used. So we're really looking to increase that use. And then again, we talk about open burn permits. That's something that we would work in conjunction with the local fire departments on, but really coming from a public health point of view. So if you think about spring, when we see a lot of burning with slash piles, when we have temperature inversions, that smoke gets held down. And, working with the fire departments to really incorporate that aspect of public health into when people are going to burn, to assure that we're not impacting the health of people in the community around those. A great example is I've been in Snowmass Canyon, where you see slash piles get burned. That canyon will be completely smoked out, and people who live in Phillips Trailer Park appear to be heavily impacted by something like that. There are other examples, but I see that one probably every year when I'm driving up for community. So again, working with them to really educate people on the appropriate times to burn and making sure that we're thinking about health when we do those burns is an important piece. Next task, the State Health Department has OWTS, which is the acronym On-Site Wastewater Treatment System, also known as septic. That we base our regulations on, as do all jurisdictions in the state. They have just updated their regulations. We're now working on ours. We need to bring those updated regulations to the Board of Health for adoption. It's a process that we're anticipating we will have those to you at I believe it'll be a January Board of Health meeting. We have the regulations right now. We've updated them. We're about to submit them to the State Health Department. They have 30 days. We have to put them out to public comment for 30 days. So that'll put us in the time frame for that January meeting, and then would take effect 30 days after the approval of the Board of Health. At the same time, we've had update air quality regulations that really falls under this idea of the air quality specialist, but knowing that that has been contingent for the last several years. We're at the point where there's some issues with our own air quality regulations and county code that are conflicting with building codes. So regardless of the air quality specialist, we needed to go ahead and update our air quality regulations so that we're not creating some conflict. In the disease prevention, I have Epi up there, really epidemiologist. One of the pieces that we've been working on that we need to finish up in 2026 is looking at completing our tuberculosis or TB communications with local providers. One of the things that we're working on is with local providers, if they're conducting TB tests, is getting that information into our department to help us follow up instead, again, waiting for it to go through the entire state system before we get it, especially working with CHS. Since there are clinical services aspect, it'll just help us to more rapidly react to those and more clearly tell people, or especially local providers, where they need to go with that information. Emergency preparedness. We had some questions around a call up this last summer with the emergency manager when they activated the EOC. So we want to work with them on the after hours call down list as well as CDPHE, and talking with them a little bit about that. We're realizing that there's some other aspects of their call down list and expectations that we're all going to make sure we're on the same page with, especially when we think about after hours weekend service. And while we now have staff, which is great, we have several of us that are available. I think there's still some questions around how that process can be more smooth and more clear. It's some hiccups a little bit this year, I'll say, with the rabies sample submission process. Nothing major, but again, it's an internal process that we want to dial in a little bit more. And the last piece is assessing the usefulness of MRC, which is a Medical Reserve Corps. We started looking at this year, and this is something that, again, Jordana talked a little bit about with our pillars. It's it's a volunteer organization with people who have medical training that we could utilize in an emergency. So when we think about backing up CHS with their limited capacity, would this be an opportunity to utilize an MRC? There are a lot of things that we still need to assess. Again, we talk about COVID learnings. Volunteer management was one of the big challenges in COVID, that we had some barriers that we've identified now, and we need to figure out if we can actually get through those more easily to actually manage volunteers. And then the other piece is just in our community, being rural or mostly rural, do we have actual volunteers that aren't doctors at the hospital who then would get called up in emergency at the hospital? And so does it really make sense to have that organization if everyone is going to have primary positions that aren't going to allow them to volunteer? So there's some work to do there, but we really are hoping that that might be a way to help us with emergency support. And the last one, support CHS in the provision of clinical services. Again, this is something that is year in, year out, but I think obviously given the uncertainty right now, it really becomes imperative that we're making sure that we're supporting them. As we've mentioned, they're the clinical arm. We have 3 contracts with CHS for core public health services, tuberculosis, and in general communicable disease investigation where we need assistance, clinical assistance. There's a family planning contract and then an immunization contract. And so as Liz talked about at the last meeting, the changes in the federal Title X funding are impacting CHS. And so, we're trying to understand with them how those impacts may impact not only who they can serve, but then the financial aspects of the losses that they're taking, and how then are they looking at recovering those losses to continue to provide those services. Immunization, again, we have a number of changes potentially. There's a lot of uncertainty with immunization and how those changes are going to impact that contract with them and the costs with them. And then again, who needs those services may change as well, and their service demands then. And TB, again, since COVID, we've seen TB continue to rise and rise and rise in terms of just for tuberculosis. We have a couple of different types of cases that we work on, but the number we have active, we had an active for the first time in the decade that we worked on this year. But we also have other cases that we work on, and the burden for those continues to rise with CHS. We used to have a contract with the state health department, but because we did not, in their eyes, have a lot of work, they cut that contract. And Jordana and I continue to advocate for funding from CDPHE for the tuberculosis contract, because we continue to see a lot of work, more and more work each year coming out of that.
Sorry, I'm just
Yeah.
one that really keeps meetings on time. So we have 7 more minutes. of the budget.
Yep. I'll flip through. Next slide, please. This one's really quick. So revenues. Interestingly, at the end of the day, the immunization grant we have with the State Health Department was an increase just under $1,000. This has bounced around several times. Again, that federal funding tie-in that we were talking about earlier with the state blended. Initially, this we thought was going to be a loss because CDC wasn't telling us what the funding is. We just received that information. That's an increase. Decrease FEP grant, the emergency preparedness grant, is decreasing by $11,500. Again, that's federal funding that's going away. But it might be coming, right? So for now, this is the best information we have. Again, our radon grant has gone down. That is, again, mostly federal funding that has gone away from that program. And then the state still has some funding, so we had to adjust it to address that. Expenditures, if it gets approved, the new air quality specialist and the aspects of that position being included.
Thank you so much. Right, sorry. You have a question?
Question about the arsenic in Grizzly Lake, which deals with Lincoln Creek, because at the end of the season, they were going to drain that lake. What was the outcome of that? Because I wasn't aware of any kind of increased flow coming down the Roaring Fork. What are their plans at the present time?
I think instead of arsenic, I think you're thinking of copper in Grizzly Reservoir.
And copper.
Yeah. So there's plans to drain the reservoir next year for some maintenance. That will happen next year. And we're already working with the owner of the Twin Lakes Company in trying to assess the issues we had 2 years ago, or sorry, last year with draining the reservoir to make sure we don't have those.
Thank you.
Yep.
We're gonna stick to the budget right now because we got 5 minutes and Jordan has to present the whole thing.
I just want to clarify though, is it arsenic and copper or just copper?
Just copper.
Thank
Just
you,
copper.
because I don't want the
Okay.
Yeah.
community to think that there's arsenic up
Yeah.
there. There is
Thank you.
not. Thank you.
Thank you.
Okay, if we go to the next slide, this is where we'll need the board to hopefully make a recommendation to the BOCC. So this is our 2026 budget. If you look, and I sent this out ahead of time.
And
so-
just to be clear again, what we just talked about, that new position is not on here. So you'd ask for that separately and then it would be included in the budget.
Correct. So we have made these requests, these two new position requests. They've gone through our admin process.
And what's the second one?
The second one is the behavioral health
So
facilitator.
that the funding is there, that's just a change in title. as they
Exactly.
call
So
it.
the behavioral health facilitator position is included in this budget. The environmental health specialist
you.
focusing on air quality is not included here because we do not have any other funding source for that work.
Got it.
So at this point, the big picture pieces of this budget, you'll notice an increase in revenue as well as in professional services. This reflects that public health will now be managing the withdrawal management contract with Recovery Resources as part of the mental health fund. The public health fund is also spending down fund balance. But it started with a higher fund balance than needed. So the objective is to keep the fund balance within 10 to 15% of the operating expenditures, knowing that the general fund serves as a backup. The ending 2030 fund balance projected out here is 14.5% of operating expenditures. And the mental health fund balance is also gradually decreasing, but at a slower pace than in previous years. For 2026, the transfer from the general fund, so that's a subsidy from the county in general, increases to 1.1 million. $902,676 come from the Healthy Community Fund. That's the 22% to support public health. And the transfer from Healthy Community Fund for mental health, which now includes both the regular contribution of $304,985 plus the contribution for the detox or withdrawal management, which is an additional $101,603. So Kim, Dr. Levin, to your point, the Healthy Community Fund
provides about 28.6% of the public health budget that we see here. So a big chunk, not just for our services, but also those that we contract with. And then we talked about the positions that are included and those that are not.
Anybody have any questions about the budget? And if not, I will entertain a motion to approve it for,
So moved.
do I have a second?
Second.
All those in favor?
Aye.
Any opposed? Great, please proceed with the BOCC.
And thank you. We will bring this to the BOCC, noting that it has been recommended by the Board of Health. We have just one more slide on the Smuggler Superfund budget. Because it is its own separate fund, it has its own separate budget.
Yes. And again, as a reminder, environmental health has a separate fund that is for helping to offset the costs of managing the Smuggler Mountain Superfund site. We have the contractor, who's Tom Dunlop, is actually our Superfund manager. So that helps to pay for his time. A couple of things that are happening. We have funding that had been coming to that fund, I guess is the way to say that. That got taken away. It was a state funding piece. They took it away for a year. They actually did give it back to us. So we're working with the landfill to restore that funding. We're also increasing it. We're allowing us to increase it. So starting in January, we'll be doing that, which is great. And then we've had a couple of identified issues with the soil removal process, which is part of the requirements within the Superfund site, that everything except the actual mine is annexed with the city. So technically we have an MOU with the city. They're the ones that manage the process, but we signed the agreement with EPA. So we're going to work with them to identify a couple of the issues we had. So those are kind of some of the bigger priorities. We have several others, but those are kind of the big ones that we're dealing with right now. And
Next slide.
you want to talk about it, or do you?
Sure.
Okay.
I think, just the big takeaways here are that Superfund is gradually spending down the fund balance, although the actuals each year tend to be less than what we budget. So we think that it will take a little bit longer to spend it down compared to what is shown in the 5-year plan. To Kurt's point, one of the big challenges that we're having here is we're working to understand if it's possible to have that HSRF fee, which is charged at the landfill for everything that goes into the landfill and stays there. See if we can adjust that fee so that it completely supports the work at Smuggler into the future. So that might be something that we come back to the board at a future time with.
Do we have to approve this budget too? Recommend approval to the BOCC. Does anybody have any questions? If not, could I get a motion to recommend that we send this to the BOCC for approval? And a second? Thank you. All those in favor? Aye.
Aye.
Anybody opposed? Thank you, Jordana. Please recommend that as well. Thank you all. And thank you for being timely. Harley. Thank you. The respiratory disease update.
Yes, we are going to try to keep it short and sweet. Our big overview, as of the end of September, respiratory illness season is sort of officially in kickoff. Fortunately for us, as well as across the country, COVID-19 is starting to see the wane in that kind of late summer increase in activity that we have come to go associate with COVID-19. If you're looking at that graph on the right, this is all of influenza-like illness, which encompasses all of these respiratory illnesses as well as many others. But we can see that dotted red line, that light increase in activity in that late summer has started to decline as well. So in generally, looking pretty good for COVID-19. Flu, there is virtually no flu circulating. The one exception to this, unfortunately, is H5N1 or HPAI. We've talked quite a bit about this in previous meetings. There was a lull in activity over the summer, but with the fall bird migration, there has been a dramatic increase in detections at commercial poultry and dairy farms, as well as wild bird detections in the state of Colorado. So unfortunately, H5N1's around. Fortunately, it is not in humans yet. So watching flu, and there is increased surveillance going on in the state of Colorado going into flu season. So RSV, fortunately, virtually there's no RSV circulating. All of this to say it's been fairly quiet right now, especially with the off season in Pitkin County. That being said, we can expect that to change in the next coming months. So we'll be keeping an eye on it, but there is no indication that any of this is super alarming. We are well within sort of the bounds of normality at this point. Slide. The fun one. So there has been some kerfuffles about seasonal vaccine recommendations. Tried to give a super brief overview through all the complexities for all of our seasonal illness recommendations. Flu and COVID are similarly, but a little bit different. Flu is who, where, how much. Almost all of these should be covered by Medicare, Medicaid, private insurers. Everyone should be able to make appointments at their physician's offices, pharmacies, community health centers, anything like that. So flu and RSV are pretty status quo with what we've seen in years past. I do want to highlight that we have received some questions regarding RSV vaccination for older adults. This is not an annual vaccine for older adults. They do not need to go make a secondary appointment if they have already received that. But just want to highlight that these should all be available at this point. COVID-19, I know we spoke about, and many of the people in this room have paid attention to what's been going on at the federal level. Fortunately, last week there has been approval and sign off by the CDC director. And so we have much more clarity right now as to who, what, where, how much, all the good stuff. The secondary asterisk there is just there is a discrepancy between the FDA approval and the CDC ACIP approval. And this is potential, is potential to cause confusion at the public level, the community level. But fortunately in Colorado, POLIS did sign in public health order that allows almost everyone who's looking for a COVID vaccine to go ahead and make those appointments through their preferred channels. So,
And just to be clear, this is a new vaccine. So some of the doctor's office, like my office, got him for the first time last week. So we've got him. So this is not the one.
exactly. This is an updated vaccine to reflect the current variants that are circulating. The prior season's vaccine was actually requested to be shipped back. So that shouldn't be on anyone's shelves anywhere. But again, these vaccines are really dynamic. They're able to assess address the needs of the current circulating variants. They are safe, they are effective, they offer fantastic protection to those who want them. And that October is the best time to make your appointments, but really any time that you can make your appointment is that time. So, all right. And then another fun one, but a cool example. Speaking of respiratory illnesses, measles is hot and heavy in the United States as it continues to be. That upper graph shows sort of the scale at which we're seeing measles in the United States in 2025. Fortunately, we have seen a decline since the closure of that case in the outbreak in East Texas. But in general, just this week, it was reported that we have 1,544 cases in the United States. That is very high. There are 3 deaths. 92% of those cases are occurring in unvaccinated individuals. So again, just to highlight the efficacy of the MMR vaccine, which has changed now. And that hospitalization rate fall is pretty standard across all those cases, especially that 22% in children under 7. In the state of Colorado, we have 27 cases totals, but no deaths, fortunately. Vast majority of these cases in the state are associated with travel or associated with outbreaks like what happened at Denver International Airport. Throughout the winter season, it does look like all models are indicating that we will see an increased risk through this winter season. Traditionally, before the MMR vaccine, measles was a seasonal respiratory illness. And so certainly on the lookout for this, we've worked really closely with schools and child cares to get the word out about how to identify measles, what to do if you suspect measles, et cetera, et cetera. So feeling like we have done quite good outreach to our most vulnerable populations. The good thing about measles, if I can say such a thing, is that due to one of the cases that occurred in Mesa and Adams County, I didn't do it, but the wastewater surveillance group was able to functionally prove that wastewater detection is able to detect as little as a single case in a large scale county. This is excellent news. This really went a long way to kind of validate the efficacy and effectiveness of our wastewater monitoring. And so that lower visualization is actually a heat map that LPHAs all have access to. Again, in Aspen, we were really fortunate to have wastewater detection and surveillance occur locally. And so this is actually from our wastewater site. There's no measles, but that we are able to track this every single time that they are submitting those samples, which is roughly about once or twice a week. And we are able to determine if it is a wild type, so an active case of measles, versus a vaccine derived case of measles, since it is a live vaccine. So going into the winter, we will be able to see this. And it's just an excellent additional surveillance tool, especially with our high rate of tourism visiting in and out of the county. So that was all I had.
So a question for you about, I really appreciate the outreach to the preschools. Are you doing outreach about vaccination to preschools and adults?
Oh, yes. These all childcares and schools have to go through and actually report their vaccination rates about this time. So they're going through and validating this. They are collecting any exemptions. And so while we do a lot of outreach, quite frankly, it falls a lot to our childcares and our school nurses, which do an incredibly heavy lift as that trusted source of information for many of these families. So we are here to help support those individuals who already have those pre-existing relationships with families, but we try to arm them with as many facts and handouts and one-pagers as we possibly can.
Any other questions for Tyler? I did just want to say another comment, which you may or may not agree with, but for adults, I think that if people are unclear if they've gotten their MMR ever in life, they should just go get vaccinated. This is children too. You don't need to get tested for your antibodies. Just go ahead and get another vaccine. And I'm sure public health, community health services has these readily available, as does your physician box. Thank you. Very, very prompt. Thank you. All right, behavioral health strategic plan update. That was a mouthful. Jenny.
So, why a behavioral health strategic plan? For nearly as long as the public health department has been a part of the county, we have been working with partners to come together and join our funding together, evaluate the community, do some strategic planning, and understand how we can best use those dollars. So when we first started these efforts, they were really focused in on how do we plug these service needs along the mental health spectrum of those services. We've been working together with a number of partners that now include the school district, the Aspen Valley, Pitkin County, City of Aspen, and Snowmass Village for a number of years to be able to fund those services. In the last year or so, that group recognized the need to, again, go out, do a strategic plan, do an assessment, figure out what should we be funding those same services, and what else has changed. What should we be looking to fund for how organize ourselves in the future to be able to address the changing needs in the community. And so that is what we will be presenting to you today. We've done, in order to accomplish this strategic plan, we put out a request for a proposal. SHG was the consulting company that won that bid. And they worked with us from the new year till about June of 2025 to complete this plan. Nancy, if you can go to the next slide.
So SHG advisors did a comprehensive mixed methods approach to the plan. They began with a review of what's already available, previous plans, what's been presented in our area, as well as best practices around the state. They did extensive stakeholder engagement, which was a key component of the process, 9 partner meetings, 24 structured interviews, and 7 targeted focus groups to really gather information from across the community, across our partners about what's happening and what's needed. For transparency, SHG implemented a landing page held weekly leadership meetings with public health and human services, and kept an eye on changes in the behavioral health ecosystem. Next slide, please. So they did a scan and found that Pitkin County is already doing a lot of great work. This one has multiple graphics, Nancy. So if you can advance to one more, please. After that initial scan, their first finding is that there's already a lot of strong work going on. This slide shows the broad array of partners and initiatives involved in the behavioral health continuum of care and who participated in the process. And then the center part, which was one more advance, please, shows the approach, creating a shared vision, establishing strategic priorities, determining the best leadership and governance structure for the plan, all of that supported by coordinated funding for a greater impact. Next slide, and that's to Jordana.
So really, lots of changes. It's kind of the theme of the day today. So these are 5 potentially large impacts on behavioral health. They're the first impact of the Behavioral Health Administrative Service Organization, the FASO, now coordinate mental health and substance use care statewide. This is a change that just went into place in July of 2025. So Rocky Mountain Health Plans is serving our region, and we're still really waiting to see what this rollout is going to be. Regional provider transitions, so helps our local safety net provider, Mind Springs Health, has been acquired by Health Solutions West. With that change, the Grand Junction Inpatient Psychiatric Hospital was closed permanently. And there's a new Vale Health facility that has opened up all during the same period of time. Lots of transition required. So the program management licensing is being overhauled. So it was supposed to go into effect July of, actually this year it was going into effect. Now it is planning to go into effect July of next year. But basically the detox licensure is going away, and the facilities that are currently operating as detoxes are having to determine how else, what other kinds of licensing they might be eligible for, walking center or different kinds of model. So that will be a big change for us to address locally, as well as an opportunity to potentially redesign some local and regional boards.
Is that just in Pitkin County, that the licensing is going away?
Statewide.
So does that mean no detox centers? They have to do something else?
Yep, so the current detox model will not be available. They'll either need to be higher level of care, or they'll be much lower.
We talked about this as one of, I know.
It will affect our detox. It will also affect the CNS health that's happening.
I've heard discussion that the state could possibly offer waivers in rural areas, but we don't. That's just a big unknown.
When we need to go, we go to the state. We'll go give them our earphones one.
Yeah. Youth intensive services and expansions. So there's some Medicaid, healthy, some reforms related to Medicaid behavioral health services for youth that are changing. Global crisis in-home care, intensive coordination. And then the last one we've already discussed today, but we know that federal agencies are having impact. So in the behavioral health sector.
I would have a small addition that, in addition to the transition of Mind Springs to Health Solutions West, we've seen leadership changes at almost every behavioral health nonprofit that we work with in the Valley. All of the major players have have changed in the last few years. So just more relationships to work on, and potential changes in the way that they offer services.
And I think that plays a role is just getting over everybody.
So if we go to the next slide, these are the 6 goal areas that we will talk through today. In each of these different areas, the Girl Health Strategic Plan that's been sent out to the board previously, will also include it in the follow-up note. Includes background and need for this goal area, the definitions related to them, any kind of recommended models, frameworks, and examples to consider. Key recommendations with very detailed strategies and tactics, governance subcommittee structure and key players for implementation, resource considerations and potential funding sources, as well as data and outcome measures. So this strategic plan is not like our department strategic plan that we're hoping to be like pages. This is about 80 pages, lots of things in the appendices that are going to be super helpful when we get down to the brass tacks of starting work.
Because it's a strategic plan for so many different entities that you're working with. Correct.
And, it's a 3-year strategic plan. We really asked the consultants, we've selected them because they had so much expertise in behavioral health and in some of these changes that are going on in the state. So we asked them, what are programs that exist that we're not using? What are some potential models? So they researched a whole bunch of those opportunities and kind of put them for us to say, when you're ready to consider, that they're here for you.
And it'll still take a ton of partnership, and the structure requires a lot of support from those individual agencies as work groups. But it means like digging into the nitty gritty with the folks that are on the ground, with the folks that are leaders in those organizations, to make sure that we truly understand the local landscape, what is offered, what's not being offered, and what we need to do next. So I have the first 2 goals to talk about, which largely deal with the structure, putting a structure in place to support the implementation of the plan. So the first step is to ensure that there's a governance structure to support that implementation. Because there were not any other natural backbone entities in Pitkin or the region poised to carry forward the work, the suggestion is to go with a county-led model at this time and review within 3 years. The best chance of success for a plan like this is to dedicate resources to the work. That's been echoed by the Katz Amsterdam Foundation, which has been doing work with other mountain communities. We've met with them several times and learned that as they've studied communities that take on behavioral health systems work, the presence of a backbone is key to success. So we determined at this time that public health is the best position to be the backbone. The public health, we would begin doing the work that's described on this slide and act as the main facilitator of the plan, as well as reporting back on the progress. Initially, we would convene the advisory group and then add the work groups as we get to those areas in the plan. Because we are sunsetting that current position to initiate this work, that will keep the budget impact at $0 compared to what we are doing right now. Just acknowledging that work, the data work has been really critical and really helped this work get off the ground and move quickly, because that strategic plan, they only worked with us like 6-7 months to figure out all of this. So that data was critical, but at this point, that facilitation is what's key, getting the partners together, continuing to grow those relationships and get everyone in the same room to come up with great solutions. We also plan to keep looking forward and hopefully find an organization that can carry this work forward in future years. So per the plan, Public Health would hire the behavioral health facilitator in early 2026. That would be a full-time 3-year term limited employee. No budget impact or FTE increase because of the data analyst position. The funding has been approved for 3 years by the Environmental Health Services Funders Group, which is that group that's been getting together trying to solve behavioral health problems for a while. The position will be split between governance and funding duties, and there's a detailed position description in Appendix C of the plan. They'll work on advisory group and work group logistics, as well as member recruitment and onboarding, partner relationships, and internal and public communication, and developing a landing page, engagement tools, and reporting out. We can go to the next slide. Another thing that we found is that there are already a lot of great investments being made in the behavioral health landscape in Pitkin County. And this is just a sampling of the different ones that are part of that. But we want to make this part of the system more streamlined and effective. The desired outcomes to this are to reduce duplication, improve communication across funders, grantees, and applicants, promote complementary investments, and enable a long-term systems level impact. We've already started working toward this by bringing together the Withdrawal Management Funders Group and the Vital Mental Health Services Funders in preparation for aligning them in 2026. And Jordana has mentioned that withdrawal management will now come under public health's budget. That's part of that process, bringing those two together. And there may be a little bit more detail about that, but that is one way of consolidating. We're going from 2 meetings, 2 separate groups of funders to 1. In the long term, our goal is to establish a formal funding collaborative that would be supported by a dedicated backbone entity that would convene and coordinate funders, facilitate information sharing, and align and distribute funds strategically. Next slide.
Okay, goal number 3. This is to build a coordinated resource navigation system. Great. So what was found when the consultants came in and looked at our community was there are a lot of resources. There are some organizations doing this work of navigating people through the system very well, but it might be for specific individuals. So Aspen Family Connections does this work very well for children and families. Recovery Resources does this work very well for their clients. PACT does this really well for their clients. But there's not a great system for anyone in the community. And so this goal would be really looking at establishing a formal community-wide resource navigation system that connects individuals and families to services and enhances that cross-sector collaboration. And so the goal really goes through and lays out how we would need to bring a work group together to just understand what navigators are currently doing, understand who's doing what are the current systems that exist, figure out how we can do some better cross-sector collaboration, knowing that we need regular coordination, meetings, knowledge sharing, resources are always changing. How is everyone staying up to date on that? Outreach, that's to just individuals or community members. How do they know where to go when they need to access a resource? And also data tracking. So how do we know what the service gaps are, as well as what are we doing well? What are the needs? What are emerging? How are we tracking that and continually addressing that? So that's goal 3. Goal 4 is to strengthen the behavioral health continuum. And this is, we've got some short and long-term goals here. So when we look at the services from prevention and early intervention all the way through treatment and recovery, there's a need to assess and build up alternatives to inpatient care. We discussed earlier that those inpatient care options are going away and being overwhelmed. So what else can we do? Evaluate the need for dedicated beds at that Vale Health facility, and if there might be some opportunities there. And also, how can we leverage telepsychiatry consultation? Let's use technology to be able to help meet one of our gaps, our needs in our community. Longer term, can we identify new services or levels of care? Reimagine recovery facilities through a local, regional framework. There was really a lot of great discussion during this strategic planning process about what are the services that we need to have locally, and how do we recognize what we don't have the volume for or expertise to provide locally, and how do we work with our regional partners to be able to provide that. And then finally, assess and potentially redirect funding to strengthen that behavioral health safety net. All right, 2 more goals to go. Goal number 5 is around increasing and improving access to services. So we know that we have the mental health fund here locally. This is where Aspen Community Foundation has some philanthropic dollars that they provide to headquarters, an organization that then works with providers who have patients who might not be able to afford care, to be able to access the mental health fund to provide counseling services. Is there a better way to maximize that? Is there a way to make those funds go further or raise funds? Can we identify further incentives for providers to accept commercial insurance? We know that the number of providers that accept commercial insurance is especially low here in our valley. So trying to look at that point, exploring reciprocal licensure. So folks that are licensed in other states would also be able to practice here without getting relicensed. And then leveraging existing state programs for youth. So there's a lot of potential in this goal that we just need to be able to gather together a group of our local providers to work through this. And then finally, goal 6 is really about workforce. So ensuring a diverse, skilled, and community-rooted behavioral workforce. How do we incentivize behavioral health professionals? How do we promote behavioral health careers? How do we leverage online platforms? And finally, expand and strengthen those formalized peer support networks. Those are all the goals. The next slide just walks us through some of the next steps. The big hurdle or big exciting one is to be able to hire a behavioral health facilitator to really help lead the implementation of this strategic plan. This can happen pending the approval of our budget, which includes this position, which you all voted to recommend today. So that is one more step in the right direction. We've got some of our funding partners who are eager to reconsider funding formulas for how they think about putting money into funding these joint behavioral health services for the community. We also are working on launching a landing page so that all of this information will be available to the public and to those behavioral health partners who will hopefully be participating in these work groups as we move forward. And we'll bring those funders back again to keep with some of those goals of getting the funders understanding what each different partner is funding and how we can better start coordinating at the behavioral health front. So the next slide is just opening it up to the board for questions or feedback, or if you're willing to share what part of the plan you find most exciting.
So is this something that we approve? Okay. And I guess that's my question is, I mean, I just think similar to the other strategic plan, possibly getting a monitoring update would be really beneficial on some of these things as well, since you have them listed out, and maybe once a year you could be like, here's what we found out. Because I think they're very lofty goals. And working very intimately in this part of our valley. Good luck. Thank you and good luck.
At this point, we're really looking for our members Groups will have some kind of steering. And then we'll have work group members. So we'll look at the whole area and then add to numbers. So we're starting to track that out to make sure that we gain all of that knowledge for what the behavioral health take fire around some of the ideas for who to reach out to services.
The school district, as a funder and as a partner, was very much a part of the strategic planning process. They were part of, one of the focus groups was about school age kids and their needs and so forth.
Great, thank you so much. That was a great presentation. Move on to our proposed 2027 meeting schedule.
So the next slide, Nancy. This would be keeping it on the same cadence as we had it this year. With meetings, quarterly meetings occurring on third Thursday on the 3:30, except for the October meeting, which will be on the second day. We've done that in the past because of presenting needing to approve the budget before those to the.
Does this look okay to everybody? Have any feedback? Anybody online have any comments?
Looks fine to me.
We go ahead and vote on these, right? Or
They actually get voted on our first meeting on January 15th, which is, yeah, we'll never make sense. No, it doesn't. We'll address those rules when we go back to do our bylaws again, but for the time being, this is our thought. We'll present them to you, but we will formally approve them.
thank you. All right, moving on then. Round robin. This is a time where anybody can bring up topics, questions, things we want to see. We're burning to talk about.
I've noticed the DPR station will be becoming more active outside just the station. Alexander there is very experienced. Just hard hitting from something for partnership.
Like we do our writing, you mean, in the paper? Similar to that. If there's a
Yeah,
topic that comes up.
Co-administrating.
Interesting. Thank you. I know. Knock on wood, I don't have anything today. Well, seeing nothing, thank you guys all for your attendance. Thank you for being very prompt. I appreciate it. Our next meeting will be held January 15th here. And I'm. That's okay.
Say one thing, board members, be on the lookout. I'll be looking for the end of the year to schedule a time with you, just to do kind of our annual check-in. So that'll be coming.
And do we have an article that needs to be?
We've got Linda and Tom. We are writing articles throughout this last quarter.
Great.
If we're still interested.
Immunization.
Connect. We can, if you want to talk about it now, or we can connect offline to kind of fine tune if you're still interested in writing one and how we can make sure the topic of immunization, or I think you were trying to address vaccine hesitancy, if that still is appropriate, and we can help with some talking points. Okay.
I'm just gonna say, I we did before, I just think the more and not The more bland language. we can use. Meeting adjourned.
Are we supposed to first and second? No. First.